17th of October. Now, today I want to look at the new World Health Organization inquiry into the viral origins, where this virus actually came from, because, of course, we're nowhere near a resolution on that yet. So I want to look at that in a minute. But first, I want to show you some video I've been sent from China and some video from the United States that bear quite significantly on what we were talking about yesterday. So let's just let's go for this now. This is China. Watch closely. In we go. Draw back and deliver. Now the United States. In, don't draw back, deliver. Now let's look at that again, just so we get it. So this is the nurse in China putting the needle into the deltoid muscle, carefully aspirating back. We can't see that there's no blood, but there's not, otherwise she wouldn't proceed, but it's under her hand. And then injecting after she's aspirated to make sure she's not in a blood vessel. In the States, in we go, don't draw back, straight onto the plunge in, no idea whether they're in a blood vessel or not, and inject. So I think you can clearly see the difference in approach there between China and, in this case, the United States. But that could have been a video from just about anywhere, really. From the UK, from Europe, where people aren't giving the vaccines in the way I would like them to be given, by aspirating before they inject it. Now, I've had a couple of emails saying that people who were vaccinated, that they've had the vaccine and they could taste something in their mouth straight away. What does that mean? Well, to me, that means that if you can taste something straight away, whatever has been given has gone straight from the injection site straight into your mouth. And that's not going to happen if you give it intramuscular. The only way you can taste something straight away is if you give it into a vein. So many times I've been giving intravenous injections and the patients say, oh, I can taste that, because it goes into the systemic circulation within 10 to 15 seconds. So another cause for concern there, really. But the main topic of today's talk, I want to look at the new WHO investigation into viral origins. And we will be looking at our survey on this, which is interesting, and I'm going to leave that as a teaser for now. So, newly formed advisory group on dangerous pathogens. So you'll be pleased to hear the World Health Organization's formed this new advisory group, and they're going to be investigating this further. Now, Mike Ryan's an interesting character. He used to be an orthopedic surgeon, so he's a proper medical man. And he served with distinction in different parts of the world, but then he went to work for the WHO after an injury, I believe. And anyway, let's see what he says. This is our best chance, and it may be our last chance, to understand origins of the virus. Now, to get the definite impression here, he's playing down expectations. He's sort of playing it up. This is our best chance. But if this doesn't work, it's probably our last chance to understand the origins of the virus. Now, I don't agree with that statement, because I think there's always opportunity. But that's what he's saying. So Mike Ryan's saying, take a step back, create an environment where we can again look at the scientific issues. Absolutely. This has to be done scientifically. That's the way we need to do this. Urge China to provide data from early cases. So it looks like the World Health Organization, to be fair to them, are not getting the data they wanted from China. It looks like data is being omitted from that which is being provided to the World Health Organization investigatory teams. Let's hope the World Health Organization are able to get the information that they want and indeed need to do this. So Mike Ryan urged China to provide data from early cases. So what we're talking about, August, September, October 2019. This is the problem. This is the problem. We're not sure. We don't really know. That's the issue. So you've got a preview of a later video on there. You have to wait for that one. China's saying no more visits are needed. Okay. I mean, there was Chinese speculation that this arrived in frozen goods from overseas into China that didn't arise in China at all. It's just a strange coincidence that the Wuhan Institute of Virology have been researching coronaviruses, and that the indigenous form of the coronavirus is in bats within that rough area of China. So, bit of a pointless statement, really. But anyway, WHO team spent 4 weeks in and around Wuhan previously. I think this reported in, when was it? Time goes quick. I think this was probably back in about February then they reported on this. And you might remember this complete farcical situation. I think it was the leader, I think it was the team leader, Dr. Peter Daszak, later recused himself. So he basically stepped off the committee from the Lancet's Inquiry Commission. Look, check it out there. There's the article on it. But at the time, you remember, only one way of thinking was allowed. Now, this has been a characteristic of this pandemic. You will think as I think, or you're a conspiracy theorist. You're a tin-foil hat brigade person. And that's what this statement said at the time. Now, this is from the Lancet. We stand together to strongly condemn conspiracy theories suggesting that COVID-19 does not have a natural origin. In other words, if you're a scientist and you're standing up saying that SARS coronavirus 2 COVID-19 does not have a natural origin, you're automatically a conspiracy theorist. So if you disagree with the official narrative, you're a conspiracy theorist. And we as scientists, they're saying, stand together against this. So this really is quite dictatorial, isn't it? You will think as I think, otherwise you're basically a lunatic, is what that is saying. You're a conspiracy theorist. That is not the way to foster freedom of thought in the scientific community around the world. So imagine there was a scientist in some particular place, thought that this virus might have had an origin in a laboratory. He can't say that now because the World Health Organization have said, well, if you think that, you're a conspiracy theorist, and that could do a scientific reputation a lot of harm. So not really a good way to foster independent scientific thinking. Dr. Tedros on the current investigation was hampered by a dearth of raw data, so not enough raw data pertaining to the first days of the outbreak. We didn't know much about the first days of the outbreak, and of course this is critical to understand the origins. He's called for lab audits, which we don't have. So we didn't have that. We didn't have the lab audits. And this new 26-member scientific advisory group on the origins of novel pathogens. So they've got a SAGO. Everyone needs to have would you call it I don't know. Is it a mnemonic? No, it's not a mnemonic, is it? It's whatever that is. It makes it sound like a word. So Scientific Advisory Group on Origins of Novel Pathogens, SAGO, has been formulated. Maria van Kerkhoven, again, World Health Organization technical leader, said about this, hopes there will be further WHO-led international missions to China. So China have said there's no need for further missions. Technical lead says she wants to go back to China, for which we would encourage the country's cooperation, which of course we would agree with that. So you certainly get, even from the World Health Organization, we certainly get this sense of frustration here, and certainly shared by me, and I know many and most of you. Maria's saying more than a dozen recommended studies required to determine how the virus crossed from animal species to humans. So there's no question it's an animal virus, but how did it get to humans? Well, she needs extensive studies, and some of those simply need to be done in China. Reported Chinese testing for antibodies in Wuhan residents in 2019 will be absolutely critical. So it looks like Maria von I can never say this lady's name, Maria van Kerkhove from the World Health Organization. She understands, it seems that she understands that there's antibody data from Wuhan residents in 2019. As we said, when? July, August, September, October, we don't really know. And we need that data on Chinese antibodies. Now, I think we can assume that a lot of blood samples were taken during the early stage of this pandemic, even though it wasn't recognised, that the local clinicians were the ones that were censured, of course, the ones that were blocked. They would be curious and would have collected blood samples. Do those blood samples still exist? We don't know, but they seem to be believed to be existing, and we need that antibody data to see what's starting off here. Without that, we're really not going to find the origins of this virus. So that is absolutely, this is a direct quote from Maria, absolutely critical. And there we go, including analysis of stored blood samples from 2019 in Wuhan. We need this information. This needs to be released to the international investigators. And I will go further. I would say this needs to be released to international scientific peer review. It should be made public domain, as most research is. Or a lot of research is anyway. And retrospective searches of hospitals and mortality data for earlier cases. So post-mortem samples, for example, can be kept for decades. Can we have access to those, and can we work out from that? Now, Chen Yu, China's ambassador to the United Nations, conclusions of the joint study were quite clear. So it's quite clear that this had an animal origin. I'll just put a question mark on that. An international team had been sent to China twice already, and it's time to send the teams to other places. Now, that is the link there for my YouTube survey on this matter. And I meant to print that out on the next piece of paper, but I've forgotten. But I think it was about 79% of you believe that this virus did not have. And this was from about 20,000 people voting. About 79% of you believe the virus did not have a natural origin, that there was laboratory activity involved. Now, I've been criticised for doing these surveys, and I accept the criticism entirely. It's not scientific; it's purely out of interest. But click on the link and vote away and have a look at it. There's another survey there as well, which is there. Yeah, okay. So, not claiming that is remotely scientific, only that I think it's vaguely interesting. Okay, so a shortish video today. Now we're going to get an update from Wafafa, who's working on our community health project that you and me are both supporting in Uganda. And today he's taking Balaria to hospital. Now this is the girl that we've seen before with jaundice. So I think it takes about 8 minutes, this video, but it is. I would encourage you to watch it and to click on the links. And if you want to support this community health project, then of course you are completely free to do so with the links that I'll be provided in the description.
Hello guys, welcome to our channel. This is Wafafa Andrew, and I'm finally in Maige district. Now guys, I came yesterday night and I slept in this place. This morning Mama prepared for us some millet porridge, so I'm very satisfied right now. We are here with the grandmother who is taking care of Barira. I think she's called Barira who? Namkose. Yeah, Barira Namkose. Newe mai.
Halima Namkose.
Yeah, ono mama yeba mwit. This mama, she's called Halima. Yeah.
Halima Namkose.
This mama is called Halima Namkose, and she's the caretaker of this girl here. As you can see, it's cold. I think we need to get Barira a sweater. She's a very cute girl. Yeah, as you can see, she's a very cute girl. Only that it was the disease that was disturbing her. Her nutritional status is also not very good. I can see it. She needs our support. So I tried to go through some of the documents that they gotten for this young girl, and I found out that the documents were showing that she has some signs of cholecystitis, but other investigations like liver function tests were not done. So today we are going to withdraw her blood, and we want to do the liver function tests. We want to do the hepatitis B surface antigen test, and we are also going to repeat the ultrasound scan. Otherwise, thank you very much for praying for me. We reached here safely. I'm here with my driver. Say bye. Yeah, he was the one holding for me the camera, and there is a big man there, one of my guys also. So this is the home where they are staying. This is where Mama prepares food from. Mama, are you show us where you prepare food from? Yeah, that is where she prepares food from. Yeah, we slept here and it was well. And this is the home. The lovely people. I think this one is the neighbor. Mama, manya go bakuitani. Yani? Oh, Hadija who?
Namumbe.
Hadija Namumbe. Ozwilawa? Wano wengine? Overawa? Wenzaliwa. Buluka. Okay, so glad. So this is the place, guys. I hope you've been able to see some of the areas here. So guys, my mask has gone off. I think Grace told me that I get the N95, but I'd not yet gotten one. But I think in the next visit I'm going to buy and I get one. But otherwise, she's a chute girl, as you can see, and we are going to take her to the hospital. So guys, enjoy our video. I love you so much. We now here with Mama Halima, and we are going to the hospital. So we are going to use our vehicle. Our transport is sorted, as you can see. So we are here. Good. She's now looking very smart. I like it. Okay. That is our vehicle. There is our driver. Yeah.
That's a message.
Oh, is it a visible? So now what have you done? Good. Okay, sorry, now I have it. So we are now going to the hospital. Okay. So friends, as you all know, about 5 days ago we went to Mayuge, where we went to meet Balira, and we took her to the hospital. So we firstly went to Mayuge Health Center 4, and we were not able to get the services that we wanted. That's why we decided to move to Jinja district, which is also in eastern Uganda, but is a bit far from where I'm staying. So this is Mayuge town, and here in the video we're showing how we went to Mayuge Health Center 4. It is just within Mayuge town. So as you can see, we are nearing the Health Center 4. The signpost you're seeing is showing Mayuge Health Center 4. So that's where we first went before we went to Jinja, where we went and did the hemoglobin electrophoresis, the CBC, and the ultrasound scan, which showed there was no problem with the biliary tract, but the hemoglobin electrophoresis showed that Balira was having sickle cell. And we took her to meet the pediatrician who started her on treatment. So here we were showing how we were now heading to Jinja. For now, I'm going to leave you with a song. Enjoy it. I love you all. See you in the next video.
I'm going out into the world, taking hope to the hopeless and the needy. God will guide me unto the end. If you don't mind, please come and go with me. I'm going out into the world, taking hope to the hopeless and the needy. God will guide me unto the end. If you don't mind, please come and go with me. In the darkness where I go is overwhelming. Whatever I see, heart filled with sorrow, eyes full of tears. Please God, use me as I am to heal the pains and bring hope to the world. I'm going out into the world, taking hope to the hopeless and the needy. God will guide me unto the end. If you don't mind, please come and go with me.
No, it's just not fair, is it? I mean, some people, like Wafafa, not only the competent medical clinicians, excellent horticulturists, they're also artistic and musical. You could put, well, I'm certainly not artistic and musical, that's for sure. My horticulture's got a lot to be desired. Anyway, so this girl, Valeria, she basically, her eyes went yellow. She got this jaundice, and they checked out various things like inflammation of the gallbladder, that's the cholecystitis. They checked out the liver function test. They checked out hepatitis B, which is very common there, but she hasn't got. And it turns out she has this genetic disease called sickle cell anemia. So what she's actually doing is she's breaking up, during the sickle cell crisis, she's breaking up too many of her red cells. Her spleen's breaking up too many of the red cells, and the breakdown product from the red cells, that the bilirubin is accumulating in the blood, and that is what is causing the jaundice. But as you've seen, she's now being treated for that. And of course, your donations paid for all of this work and for the vehicle and the medical fees and everything. So thank you for that, and thank you for watching this video.